And one of the questions coming through here, please ask the Minister about taking dogs for walk, whether people can go jogging. But before we get to all of that social distancing stuff, I just want to talk about protective gear, Minister. And people are asking about masks, about sanitizers. Some are saying they've gone to hospitals where there hasn't been sanitizers. So people very concerned about this.
Well, because this is a new program, we expect that there'll be gaps, and when people report, we'll just make sure that we, ensure that all the people there can do it, and they can actually teach people about it and make sure they practice it. This is something that we have to correct as we find that it's not being done. It's a new approach, and so we will just keep encouraging people to do it. So if they've seen gaps, we just need to go back and just make sure that people are able to close those gaps.
All right, let's talk. There are so many things doing the rounds on Facebook, on social media, of what we can and cannot do. Can we go for a jog? Can we walk our dog? How are we going to control it in terms of going to the shops? You know, we're allowed to go to a shop, but surely we can't all go at once. These are very important things. Minister, we're asking you out of desperation. Sure. Do you have those answers for us?
Well, firstly, the walking, taking a dog for a walk and jogging, there shouldn't be a problem with all of that. Even going to the shops, people should go to the shops and buy some food and some of the essentials. There's no problem with that. What we really want to avoid is people congregating in large numbers and, these big meetings where people are going to the place and cramping themselves up and so on. Also, panic buying, we want to discourage all of those kinds of things. What we also want to discourage, see, people are going to be sitting at home. Now, if you're going to sit at home and then you call all your friends and the whole group of you are sitting, coughing to each other, sitting very close to one another, drinking away, doing parties and so on, you're causing problems. People must know, we really want people to actually exercise restraint. People must keep the distance. People must keep the hygiene, the cough hygiene. That way you close your mouth and so on. Stand a bit of a distance from someone who's coughing. They must take this very seriously. If people think that President Ramaphosa is just giving them a free holiday of 3 weeks and they can just go around gallivanting, they must know that we actually are going to pay a price for it. Right now, the level of infection is still very, very small. It's so small that we can actually emerge from the quarantine. If people don't observe any of these things, won't be any better off.
Yeah.
So it's important that people must understand the precautions still are more important than anything else. There's two issues. Between people is where we're going to stop the virus from spreading. The quarantine, the lockdown is to reduce large numbers of people mixing in trains, in taxis, and moving from one area to the other. We would like people to stay at home. That's how we're going to stop the virus. Yeah. And it gives us 2 weeks for the virus to show, or 2 weeks for the virus to burn itself out. But don't spread it.
Do we not need a list of what we can and cannot do? I mean, I think just leaving it to people's own devices to listen to the advice given perhaps is not going to be as effective as we'd like it to be. I mean, in other countries, you get recommendations to say you can go for a jog, but alone. Walk your dog alone. You have to get a pass to go to the shop. You have to do those kind of things. I mean, I think, is that coming? Can we see that being released today, that we have more direction? Because just leaving it to our own devices, people are going to come together. We are going to drive on the roads and go and visit our friends. Some people just don't listen.
Well, I think it's a very good point you're making. I also think that our broadcasts and the media must also assist us on these messages. We will also be sending out messages which are encouraging people on what is right to do, what they shouldn't be doing. But I think that we must also talk to each other. The best strength we have is when we talk to each other to improve the behavior of each one and take responsibility for each other's conduct. When we're going to allow people to go and sit there, hey, come to my place, we're having a huge braai and we've got so many people there, and those kinds of things are actually going to cause us problems. I'm actually worried about people who will take this very lightly and therefore end up, because they've now got 3 weeks to spread the infection amongst each other, then they actually cause us more problem than what we're trying to solve.
Yeah. Final question from me. You take the rest. Second wave of infections. People are talking about a second wave of infections, and also the fact that there seems to be a new virus that's emerging after the coronavirus. Can you perhaps shed some light on that?
Well, I wouldn't know about the new virus. All I can say is that we're going to a flu season, so a lot of viruses are going to take advantage of us. Yes, the new wave, this disease has come in different waves. For example, if you talk about us, the first lot of infections would have come from those who have traveled, which means the epicenter is in Europe. Once those are settled, they might be contained, but what we will have a difficulty in containing if people don't take advantage of this time, which is why the president's call for a lockdown, is to actually reduce the spread from South Africans to South Africans who have not traveled. Yeah. That's really what we need to deal with. If you look at China, yeah, they had their own epicenter in China, then it spread to other countries. Now China is getting people who are coming into China, who have got new infections, and they're more worried about those because they've contained their own thing. In our case, we'll contain those who have got imported cases. We may not be able to contain the internal transmission unless our people understand that it's their responsibility to do that.
And speaking of that, Minister, so as you said, previously it was a focus on people with a travel history. People with a travel history employ people who work in their homes who don't have a travel history, who then in some instances commute via public transport, taxis, where there is no chance of social distancing in any meaningful way. So how are you going to deal with that? What sort of regulation or any precautions can be taken in that regard when people have to use a certain means of transport?
Well, firstly, those who are employed by the people who have got a travel history, in a number of instances, we encourage that they must be quarantined together. If somebody works for someone who's been abroad, they must be quarantined together with them. If not, then we'll have to find an alternative place for them to be quarantined. So that's how we stop the spread. Now, part of why we are actually talking about reduce the movement and get people to stay at home, there is no other way. People must stay at home and not travel around and not mix in large groups and actually keep the distance. That's the way you're going to contain this thing. This virus is not going to be defeated by doctors and nurses. It will be defeated by individuals. Those who will observe will be the ones who will be safe. Those who are actually exposing themselves are the ones who are going to have a problem. So we're saying all the information we're giving is to say we need to be in this together. Hand washing, sanitizing, blocking your mouth and nose, it becomes important. Keeping a distance away from others. You can use masks. Yes, there's a shortage of masks because if you want masks for everybody, for example, it's not possible to give masks for everyone who's on the trains and on the taxis. There's about 16 million people every day. Now, what we therefore are saying is that hold those trains and taxis for 3 weeks. Let's reduce the spread of the infection. Let's allow those who've got the infection to burn itself out. And within that period, we can actually force the virus to come down. And then slowly, as the virus spread, it will be fewer people involved. But if we already have these practices, it's going to be with us for good. We're not going to change it because the virus is going to be with us anyway.
So just a final question in terms of essential services. So we've seen a list, but is that a true list? Has a list been released of essential service and people who will be allowed to go out and work during this 21-day lockdown, firstly? And secondly, you say that the trains, the taxis and all of that must be parked for these 21 days. Does that mean that it will be incumbent on then those employers to move those people around during this time?
No, it means that you will have a list of essential services. We'll announce that if there are any shortfalls, we'll amend it as we go. But what it means is that for the 3 weeks, people who must move must not be moving in the way we normally do, because no one is going to be going to work except those who are going to be going for food supplies, essential services supply, and those who are manning the essential services, the police, the health services, and those that will be designated, particularly those who are in the value chain of the production of food and the production of medicine and essentials. So those will be the ones. So there will still be movement, but what we're doing, we're cutting down on massive movement. For the 3 weeks, is basically to reduce anyone getting a large number of people in a coach in metro rail that you can get infection from. It also is reducing those who would have got infection from the train, from the taxis. That's what we're trying to do. So it doesn't mean that they'll completely stop moving, but for essential services, people must still be able to go and buy meal and come back and buy, some vegetable and come back to their home. So we actually want to work on a balance here, and that's the balance that we're trying to keep.
All right. Minister, unfortunately, we have to leave it there. Thank you so much for your time, and hopefully we can do more of this during this lockdown period especially. Let's take a break.